New Mexico, and it's my first time on campus. Well, yesterday was my first time on campus, and I'm hoping I can make it through this presentation without crying. But sometimes it gets a little teary-eyed. I'll try to sprinkle in a little bit of humor so that it's not too heavy on this afternoon. Yes, Despedidas con Mariachis, and I chose this title because, well, first of all, I think the line of y los mariachis callaron from ella has been used way too much in the news as like, oh, the mariachis were silenced during the pandemic. So like, you can pick a different song to like draw from. And that's the Despedida con Mariachi. I pluralized it because I played a lot of performances at funerals over the last few years, and we'll talk about soon. But the song goes something like this. Despedida con mariachi, así lo pidió mi madre. Con gusto entrego al Eterno la vida que quiso darle. Quiero a los míos reunidos que me den mi despedida, que me recuerden alegre como fui yo en esta vida. Mi madre pidió mariachi con todo conocimiento. Viví feliz en el mundo y morirme no lo siento. Yo no quiero que me lloren, vivan sus vidas en calma. El luto se lleva dentro y se seca en el alma. So it's just an excerpt of this song that we sing a lot, and I think it encapsulates a lot of, just how mariachi music and kind of facing death and performing at funerals is really, I think, more intertwined than maybe people assume. And I've had people say, well, I thought mariachi music was festive music only, but it's music for all occasions. I've even played divorce parties. I know people joke about that, but and that was my favorite. It was this soccer team of these women that was just, it was so much fun. But anyways, I know some of you have read a little bit of my other work, and I just wanted to mention, here's me in my Cal Poly suit, and so I'm playing mariachi regularly. I see myself as like intermediate for the cajon stuff, just because I didn't grow up hearing mariachi music, and it's something I came into later in life. And a lot of my research in Ecuador was with Quechua musicians, and so this was us at the Folklife Festival in 2013 in Washington, D.C. So string music, but also flute music. And then here's me with one of the groups I played with in Ecuador, Mariachi. And you see, there's a singer. Some people ask me, what's it like? You usually have singers and instrumentalists, and you don't have to do both all the time. Like you have to in most of, the Southwest here. And sometimes you have accordion and you mix in other instruments. Let's see, how did I even get interested in issues of public health? And I think despite not planning to jump in and say, I'm gonna study the pandemic, like I think there was when the pandemic hit, a lot of scholars were thinking, what can I document in the moment, right? And I felt conflicted about that because I felt like it might be a little bit like dealing with people's vulnerabilities, maybe my own vulnerabilities. I didn't expect that I would be in the thick of things like ended up happening. And so I wasn't sure what I wanted to do, but I did reflect back on some of my work on the cholera epidemic in Ecuador. And so this is just one of the headlines I found in the archives, the newspaper archives. And when I was going through this, some of the flute elders were telling me, I think that we had some troubles with the flute tradition in Otavalo because of the epidemic, and there wasn't really a lot of documentation. And so I went through the newspaper articles and civil registries, and I made charts about the number of deaths. And I learned early on, so this was back in 2013, how much the health system can get overwhelmed, how many deaths can go undercounted, and also that pandemics usually last about 5 years. So in some ways I was really prepared for the pandemic. When people were 2 weeks shut down, I told all my friends, this is going to be 5 years of whack-a-mole with cases coming up, right? So in that sense I was prepared emotionally and psychologically, but I think some of the other things I witnessed were a lot harder that I wasn't as prepared for. So we'll talk about some of that today. But a little bit also my background and just how I see myself fit into the mariachi community, right? So even though I grew up in New York, in upstate New York, I grew up in a, low-income, first-generation family. My mom works at a grocery store, also had to work all the way through the pandemic. My dad's a mechanic. I was making doctor's appointments and vaccine appointments for them from across from California. I've had generations of my family live in Los Angeles, so I feel really connected to it even if I didn't grow up there. And even though my current career and job puts me in like a middle class kind of like privileged position, there's still a lot of ways that I spend most of my time with mariachis, with people playing for families that are often working class. And I feel like in many ways that working classness hasn't left me, even though you find yourself in other spaces. So just like some words to think of, and like kind of my methodology, my approach, what's in the back of my mind with this project. I'm drawing from feminisms, Chicana feminisms, thinking about like testimonios. So, and then I put sisterhood and mentorship there because at first I didn't know if I wanted to talk about this. I didn't know if I wanted to write about anything about this. And I had some friends, some Chicana friends and ethnomusicologist friends who were like, no, you gotta talk about it. And some of my mentors too, some of the mariachis I played with were like, somebody's gotta tell the story. Somebody's gotta make sure we have the record clarified a bit more. Then also, in ethnomusicology, there's a lot more scholars thinking about ethics of care and finding ways where labor and work that goes into taking care of people is taken more seriously. Also thinking about when we do our work, how can we be more ethical with the people we're working with, whether it's in our community or outside of our community. And sometimes that's through participant observation and it's showing up and having like food or finding other ways to be hospitable to people or listen to people's perspectives and make sure our research, if they're dedicating time to us, it's not that there can be ethical issues if we're like, okay, I'll do this favor for you later, but at the same time, if we're working closely with people, like we don't want to be just walking away and like, thanks for the materials, I'm gonna go profit off of this now, right? So thinking carefully about our work and who it's benefiting and how. And also, grief, death, and loss are things that, in some ways I've dealt with it a lot prior. I come from a big family. I remember going to funerals since I was 5. So I think like in my personal life, I've had to deal with it. And then now on a professional level and a research level and just on a daily level in LA and thinking about like their weekly level with mariachi music, it's been something I've thought a lot more about. And when you're working on research that's in your community, it's different, especially if you're living there, because you can't leave. A lot of times those of us who are working on field work, or when I went to Ecuador, like you leave. Like there's a certain point, like I'm still invested in the community. I call my compadres and I talk to my goddaughter all the time. When the levantamientos were happening and I was worried about them being attacked, we were on WhatsApp like every night for those few weeks. But it's still different than like, I can't go home from this research, right? And I can't go home from these experiences. And so there's a lot of emotional entanglements that happen. And so ethically, a lot of ways that, testimonials and this type of scholarship, you sort of end up, making a call for action or a call for justice. And I felt like the injustices I saw and the questions I had, like, are also what motivated me to kind of speak about this. And so one of the moments that really struck me, and I feel like things started making sense, where I was like, okay, I think I know what I want to say about this, was picture is not at the gig I'm talking about, but Rodrigo is one of my caimanes, or one of the mariachi leaders who hires me a lot. And I've worked with him for years. We actually met through South American music, but he's from Mexico City. He plays trio and he does mariachi too. So we were at a gig in Long Beach last summer, and it was the 9th wedding anniversary. And so we walk in, and instead of playing mañanitas like usually do for a morning serenade, they were having brunch, and we sang Hermoso Cariño. And so, that goes something like this. Hermoso cariño, que Dios me ha mandado a ser destinado no más para mí. Precioso regalo, del cielo ha llegado y que me ha colmado de dicha y amor. So we walk in, we squeeze into a little walkway, we get to the backyard, surprise everybody. The dachshunds are barking at us because dogs never like it when you show up. And we're having this nice party. It was a couple hours. We got like café de olla, we got pan dulce, we're like hanging out and chatting. And we're playing a lot of cumbias. They wanted to dance. They had a few close friends there. But then, somebody ended up asking for Amor Eterno. And some of us were talking about this song last night. If you play mariachi enough, there are enough people who ask for Amor Eterno because they think eternal love. And they sometimes, even one of my family members are like, oh, that was mine and my husband's song, right? But it's actually about, what it's about, right? Juan Gabriel's mother who passed away. So it's kind of like, classical musicians, when normally we won't pick dun, 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 for like a wedding because you're like the history of that tune, where it's used in that opera. It's like, no, I'm not going to do that. So Amor Eterno, sometimes, people ask for it. You play it because it was requested, but it's sometimes kind of an awkward song, especially at like a 9th wedding anniversary, right? Or, and it can be a mood killer, especially when people are all dancing, because it's a really sad song. But we said, okay, you sure you want that? All right, we'll sing it for you. Here it goes. And so I translated some of this. This is about half of the song. So, tú eres la tristeza de mis ojos, que lloran en silencio por tu amor. Me miro en el espejo y veo mi rostro, el tiempo que he sufrido por adiós. Obligo que te olvide el pensamiento, pues siempre estoy pensando en el ayer. Prefiero estar dormida que despierta, de tanto que me duele que no estés. Como quisiera, ay, que tú vivieras, que tus ojitos jamás se hubieran cerrado nunca y estar mirándolos. Amor eterno, inolvidable, tarde o temprano estaré contigo para seguir amándonos. Right? And so I sang it, and I was like, this is kind of awkward, it killed the mood. And I looked out, and usually, Juan Gabriel was pretty fantastic. He's one of the people I wish I got to see before he passed away. Pretty fabulous. There's always like a tia who's into partying who asks for all sorts of Juan Gabriel songs, and they'll yell to them. And so sometimes, even though it's a sad song, it's like one of his biggest hits. So, and then occasionally there might be like one person who tears up. But what struck me about this performance at this gig was that when I looked up, everybody at the whole party was crying. And it struck me because I had never noticed that happen at a performance like that. And basically it just made me feel like there must have been so much grief happening. Like maybe there was a recent loss for everybody in the family, but there were friends there too, so it was hard to tell. But I knew that they weren't crying about me singing super wonderfully or super horribly. So I figured they just had like grief overflowing from them. And I started thinking about all this immense grief I've noticed over the last few years. And almost every happy event I've played at, a quinceañera, a wedding, birthday parties or just get-togethers, I've noticed so much more that there's a corner, there's a table, there are pictures, there's attending in spirit, or like one of the quinceañeras I played several months ago, they're making an announcement for the daughter's birthday, but then they're talking about the family members that couldn't be there and like choking up, right? So every happy moment is suddenly like touched with survivor's guilt, it feels like. So that really moved me of just like this immense grief that's happening. And so I just started thinking about like, well, how did we get here? And, I think there's a lot of times you hear stuff in the news, or you might read stuff here and there, or you might know like, Boyle Heights and gentrification, you kind of have an idea that like, how did we get to this situation? But I really wanted to dive deeper into that. So with Los Angeles becoming the epicenter, eventually in 2021, there was, so much going on. And I really, for this research, I want to focus on more Los Angeles County and were impacted negatively with high cases and with death rates. You also saw, especially like Pinoy or Filipino communities, people were, a lot of people work in like nursing or custodial work where they were in jobs where they were exposed. So really high case rates too. So I don't want to pretend that the Mexican American or Latino community in LA was much worse, but it's still complicated, and especially because of the quantity. So we just had more funerals that way, right? Because Latinos are such a huge part of the population, and then close to 50% of deaths. It was like over 16,000 deaths. I think I have the number on a later slide, where that's a lot of funerals that we were playing. And I did see, funerals for other ethnic groups or parts of Rose Hills. They have like a Chinese garden or like a Chinese part of the cemetery and stuff. So you saw like different cultural ceremonies happening. But yeah, through Mariachi, there was just so much happening with performing and with the high numbers. So by the end of 2021 and into 2022, you had a high rate of daily positive cases. The peak was 60,778, more or less. But you only had 98 daily deaths. So if the percentages were similar as earlier, you would have had almost 1,000 people die in one day. And so I know, I wouldn't say people were necessarily masking more or less at this point. But you had vaccines, like I think there were better therapies at the hospitals at that point, but still like thinking about like, regardless of how people feel about the vaccines, I'm just so thankful for the fact that whatever happened along with the vaccines, like prevented so many deaths. I don't even want to imagine losing close to 1,000 people for weeks on end, right? But still, there was a lot of ways that we were playing like year anniversaries and things like that, where we're still seeing kind of the effects. Then, this page. So in Los Angeles County, we have close to 9.8 million people who live there, and Latinos account for close to 50%, so about 4.8 million people. And that's based on like a couple estimates and then the census that also happened during 2020, which was really complicated, and census workers and like all the like back and forth, especially with the political fighting. Was it going to be canceled? Was it, all of that. But you do have a high number or high percentage of people who identify as having Mexican heritage, whether it's mixed heritage or, so like a majority of Latinos are Mexican identifying in some way. And, but mariachi is also popular, like we play for like a lot of Colombian, Peruvian, Bolivian, Ecuadorian families and things. So, but there's a high number of people who identify as Latino who also don't have health insurance. And some of that is related to the types of jobs that are available to people and which jobs offer good health care. And then also people who might be there and not have whatever legal standing and with papers and things to get certain jobs that will give them health care. So, and then there's people who, even though they might have some access to healthcare, they're resistant to going because they don't want to risk like being reported. Because especially during the Trump administration, there's a lot of ways like somebody might be reported even if they weren't supposed to be reported. They were supposed to be safe cities, and that didn't always. Border Patrol might still show up to a safe city and then fight with the local community and stuff. So people were pretty, I think, rightfully hesitant about some of those issues. And then. You also had Latinos making up close to 43% of the cumulative cases, last I was checking these dates for the article I'm publishing soon. So there are, almost 1.5 million COVID cases. And, some of this includes people who maybe got sick twice or tested positive more than once, if they went to go get tested. There's a lot of people who maybe stayed home and didn't test. So it's hard to pin down the numbers, but by December it was 50% of the deaths, so 16,242 people confirmed COVID-related deaths of Latinos alone in Los Angeles. So even if some of the other communities in Los Angeles had like maybe higher percentages of who got sick, like the populations are small enough where like you didn't see these giant numbers. So it didn't translate into the number of funerals and then like what mariachis or an analogous type of music or service would be happening, right? So basically, as you can imagine, a lot of BIPOC and low-income communities in LA were hit hardest. And that Latino paradox we mentioned before, so many people passed away and the death rates raised so much that we haven't seen this Latino paradox anymore. So like basically people are dying of all types of cases, of all types of illnesses or things a lot more than before. So the LA Times put an article out where basically the death rate, because it increased 48%, and it kept increasing after peaks of the pandemic, whereas other groups saw like a decrease. So, how I saw that translate is that, my partner and I, between the two of us, we had like 6 family members who died of non-COVID related things, but like maybe sort of related. So I had one uncle who, he was in Sacramento, but he had issues with alcoholism and depression, and so like the isolation aspects and all of that, like, or sometimes I knew somebody who passed away because they had an emergency but they couldn't get into the hospital soon enough. So there were a lot of like people who passed away, maybe not directly from COVID, but COVID contributed in some like social aspect or practicality aspect of like just getting the care they needed. The song we sang for him, that was performed for his funeral was Que te vaya bonito. And even though, so a lot of times like the songs might have a couple lines that might relate, and this is really more about, like a breakup song. But my aunt from Mexico was able to fly up to represent family from Guanajuato, and I flew up from LA, and not as many people could go because of all the restrictions as we wanted to, but my uncle's name was Jose Alfredo, and then my family's from Guanajuato, so Jose Alfredo Jimenez is from the same state. So they chose this song for like layers of meanings. When I was up there at the funeral, my family was telling me, yeah, one of our neighbors, they lost 20 family members within a short period of time, right? And sometimes like maybe the underlying conditions that families and people are experiencing, it's because you're growing up in a similar place. You're impacted by the same environmental issues. Some people might have certain genetics where like if you're predisposed to diabetes, type 2 diabetes, hypertension, cardiovascular issues, that is something that COVID really, it devastated a lot of people with, also with long-term COVID and disability, strokes, things like that. I know a few mariachis who had strokes after getting over COVID. So it was really, like, even though I didn't do much research into the numbers up north, I saw some similarities in Sacramento and the Latino community. So Que te vaya bonito goes something like this. Ojalá que te vaya bonito, ojalá que se acaben tus penas, que te digan que yo ya no existo, que conozcas personas más buenas, que te den lo que no pude darte, aunque yo te haya dado de todo, nunca más volveré a molestarte, te adoré, te perdí, ya ni modo, cuántas cosas quedaron prendidas hasta dentro del fondo de mi alma, cuántas luces dejaste encendidas, yo no sé cómo voy a apagarlas, ojalá que te vaya bonito. Thank you. I'm really glad I'm not tearing up too much. I've had some practice with this at this So as I'm sure you could guess, like if you had more time and I just guess, what are the underlying factors that you think were a problem? Most of you could probably identify these. And so one, a lot of people in these communities have had less access to healthcare. If you think about all the ways that healthcare guides our decisions for jobs, where we live, it's really hard to have access to healthcare. And then if you're working, working class or low-income jobs, and you're scraping by, it's hard to get. It's hard to have preventative care, to even know that you might even have an underlying condition, right? You also, it's in Los Angeles because of redlining, history of racism, immigration patterns, jobs, that are available to people. You also have a lot of Latinos and Mexican Americans have a higher likelihood of living in poverty, in crowded conditions, and polluted neighborhoods. So the census workers I know said, when they went through Latino, majority cities and neighborhoods, you'd see a lot more people living in certain spaces than you would expect. Like a 2-bedroom apartment might have 6 people instead of 2 or 4, right? And so, and then you have a lot of neighborhoods, if you look on the map and you look at a lot of the Latino majority towns and neighborhoods like Boyle Heights, they're totally surrounded by highways. And so, the PM2, the fine particulates that come from cars, and it's not just the combustion in the gas, it's the microplastics from the tires. So, I've been such a proponent, we're talking about public transit, there are a lot of issues with public transit, not enough buses are running frequently, or I think when we're on the bus, we're not as isolated from maybe the general social issues we see in our city, right? And it's hard, being a woman of my size, have I been accosted on the bus occasionally? Yes, I usually act crazy or shove them or, something, but to get people to leave me alone. But I think in general, I've been working to help with transit and connecting transit to campus and improving transit in Southern California by being on a Complete Streets Coalition and also on a committee on campus, because you want to reduce these things, because the driving is not so much the issue, and electric cars, they don't stop producing these fine particulates that give a lot of us asthma, diabetes, and other cardiovascular issues and high blood pressure and things that happen just from those microplastics being in the air and breathing that in, right? So electric cars will help with some of it, but not all of it. And then you have the whole issue of extractive economies and lithium and overthrowing governments in Bolivia and things like that, that a lot of the lithium batteries and companies that are using that are causing. So then you also have a lot of Latinos are working in jobs with high in-person exposure, especially janitors, nurses. A lot of people couldn't stop working. And a lot of them were working harder because of all the cleaning and care they had to do for everybody. So they were even more exposed. If you have lower salaries and it's harder to go in and find a healthcare plan where you can, just I'm with Kaiser right now, and I joked one day, if you break an ankle, they're great. And then I broke my ankle the next day and got to learn firsthand. They are great if you break an ankle. They're really efficient, right? But when you're dealing with some other conditions, some of the medical gaslighting can be a real thing. And then lack of access to protective equipment. The meat packing plant in Vernon, Farmer John's, had so many outbreaks, and they employ a lot of people in Boyle Heights, and they also pollute a lot when they had they moved out of state recently, but so you had people working in these areas where they were constantly getting exposed, and they didn't have enough masks, or they didn't separate them, and they didn't set up better ventilation and all of that. A lot of people have been displaced due to gentrification and inflation, and so if you want to, you wonder why is housing so bad in California. Acts like the Ellis Act from 1985 and the Costa-Hawkins Act in 1995, which basically put all the advantage, privilege, whatever in the landlord's hands, or the rights in the landlord's hands. So I wrote it down because I always mix them up. So the Ellis Act basically allows landlords with an unconditional right to just evict people if they want to sell their building. So a lot of people who buy properties for investment, they're like, I'm done, I'll sell it, and then everybody loses their housing just because it changes owners, right? And then the Costa-Hawkins Act basically limits which types of buildings qualify for rent control. So you have very few buildings qualifying for rent control. And all the new buildings that they're making have very limited rent control or affordable housing. So it just keeps getting worse and worse. And the amount of homelessness I've seen grow, or houselessness, like over the last several years or a decade, it's just staggering. Like, it's just been really bad. So then you get, underlying conditions like underlying inflammation, stress, not sleeping, being on your feet all the time, type 2 diabetes, and cardiovascular issues, like I mentioned earlier. Now let's see, so I'm not sure if I went way too fast, but I have 2 more examples of thinking through what is mariachi doing? Like, what are we doing for people when we're providing this care, and when people have lost everything, right? I feel like we're doing an important role of rehumanizing people we've lost, or maybe rehumanizing us if we feel like we've gone through such a hard time and we don't know what's going on in our lives anymore. We feel just completely lost, right? And there are a couple instances that made me think about it. I got married in 2021, and so I had a different experience of having the mariachi play certain songs that I've played a lot of times. And so like one of the songs is Mi Linda Esposa, and so similar to Hermoso Cariño, it's a song that's played at a whole bunch of different moments. Like maybe you see your parents dance to it because it was a song that they wanted to dance to, a really romantic bolero, and dedicated between partners. Or then you get married and then you dance to that at some point because somebody's like, oh, I'm going to play the song for you. Or at an anniversary. And then so you see these songs that develop these like layers of memory. So it's every time you sing it, you're remembering all these stages of your life. And I'm trying not to tear up. I thought I was going to make it. So, seeing like a widow or a widower or people who lost their partner ask for these songs at the funerals were really touching. Maybe I won't play it. So, you had like, or part of the song, it says basically like, I hope that God protects you for me forever. Or like, let's see, so que Dios te guarde para mí eternamente, pues me ha de separar de ti, like to separate from you, solo la muerte. Like that, it relates to the vows when you're getting married, but then later, like now that death has separated you, right? And then at the part of the chorus, it's yo aún sigo enamorado de ti, mi linda esposa. And somebody might change it to esposo, or it's still talking about this love between two people. Or so yeah, if it's the wife having it dedicated because to her husband who passed away, it still works. But so yeah, there's that. And then to end on a slightly happier note, one of my favorite moments that I had during all these years is when somebody asked for all Paquita La del Barrio songs, right? And if you don't know Paquita La del Barrio songs, it's like Rata con, or de dos patas, like, a rat with 2 feet, like, and she just sings all these songs. I love this other song of hers. It's like I want to apologize to your dog because I compared you to him, and I love your dog. He's my best friend, and you're a scoundrel. Like, you don't even compare to a dog, right? Just a lot of really great, like, despecho songs and things like that. And so we showed up, we're like, okay, it's at a cemetery. Like, I have played a couple events in the past, not funerals, but where people broke up and somebody wanted to send like, I hate you mirachiogram. Where one time, like, the new boyfriend was there and he didn't understand Spanish. He's like, wow, how random, there's a mariachi playing for us. And we're singing these like really awful songs, and you see the girlfriend being like mad, like she knows who sent us. But like, it went through like a private thing, so like we didn't know who the client was. They went through this agency that sent us. So I was like, are we doing something like that? That somebody died, they're like really mad at them? What happened? But what it ended up being is that it was a grandmother, like a sassy grandmother who just really loved Paquita del Barrio, and had been like a year since she passed away. And I think given the time of the funeral, I assumed that most people couldn't be there for her funeral. So they had like a year anniversary when it was easier for people to be there. And I hadn't like sung this song before this funeral, but I had so much fun learning it. So part of it goes like this. So, eres una brújula sin rumbo, un reloj sin manecillas, una Biblia sin Jesús. So like, you're so useless. Like you are a light without a light bulb. You're a compass without a path or like a destination. You're a clock without like the clock hands.